The Exelon patch rivastigmine transdermal system comes in 3 doses. The initial dose is 4.6 milligrams per 24 hours. If your loved one is an appropriate patient and tolerates this dose well for a minimum of 4 weeks, I will introduce the effective dose of 9.5 milligrams per 24 hours. I will keep him or her on this effective dose for as long as therapeutic benefits persists and if he or she tolerates it well. If your loved one has been on the dose of 9.5 milligrams per 24 hours for at least 4 weeks and is tolerating it well, but requires additional therapeutic benefit, I may increase his or her dose to the recommended effective dose of 13.3 milligrams per 24 hours. Here are some things you need to remember about applying the patch. The location of the patch should be rotated so that it is not applied to the same location more than once in 14 days. I encourage you to write the date on the patch with a ballpoint pen to help you remember when it needs to be changed. Only one Exelon patch should be worn at a time. The patch should be replaced every 24 hours at the same time each day. It should not be applied to skin that is red, irritated, or cut. Gently clean the application site with water and allow it to air dry or pat the skin carefully to dry. In a clinical trial for Exelon patch, the majority of patients experienced no skin irritation from the patch or had mild to moderate skin reaction. The incidence of severe skin reaction was very low and regardless of dose. The direct comparison of the rates of application site reactions reported in the placebo-controlled and active comparator-controlled clinical trials cannot be made due to the difference in the method of data collection employed in each of the trials. Only a very small percentage of patients had to stop taking the Exelon patch due to skin irritation. Some people have had a serious skin reaction called allergic contact dermatitis, ACD, when using Exelon patch. Stop using Exelon patch and call me right away if your loved one experiences reactions that spread beyond the patch size, are intense in nature, and do not improve within 48 hours after the patch is removed. Symptoms of ACD may be intense and include itching, redness, swelling, warmth or tenderness of the skin, peeling or blistering of the skin that may ooze, drain, or crust over. You should apply the Exelon patch once a day to the upper or lower back. However, if the back is not accessible, you can apply the Exelon patch to the upper arm or the chest. Please remember, you should apply the patch to clean, dry, hairless, intact, healthy skin where the patch will not rub against clothing. Press down firmly for 30 seconds when applying it. Do not apply it to areas where there is powder, moisturizer, or lotion that could keep the patch from sticking to the skin properly. You should not open the patch until you are ready to use it. If left open, the patch starts to lose medicine and become less effective. Unopened patches can be used until the printed expiration date on the package. Try to make a routine out of applying the patch so that it becomes easier for you or your loved one to get used to applying it. However, if you miss a dose of the Exelon patch, no change in dose is necessary. Do not apply 2 patches to make up for the missed dose. You may apply a new patch and resume the normal dosing schedule on the next day. If you miss more than 3 days, call my office before applying another patch. Here are some additional important things to remember while your loved one is being treated with Exelon patch. Let me know if your loved one needs to have surgery. The Exelon patch may exaggerate the effects of some muscle relaxants during anesthesia. Let me know if your loved one is taking any other prescription or non-prescription medications and what those medications are. The Exelon patch should not be given at the same time as other medicines that have similar effect on the body and brain, such as cholinergic agents or anticholinergic medicines. The medicine is absorbed through the sticky part of the patch. If you or your loved one comes in contact with the adhesive layer, you should wash with soap and water as soon as possible. Avoid contact with the eyes. If your loved one or anyone places the patch in his or her mouth, remove it and make sure no part of the patch is still in the mouth and contact my office immediately. Please be sure to review the important information as well as the prescribing information for the Exelon patch included in this DVD, and ask me questions about any information you don't understand.